2. Have any idea what it's like to hold someone's life in your tubes? I do. I'm an infusion pump, the unsung hero of this hospital. And let me tell you, the things I've seen would make your hair stand on end. You think your job is stressful? Try mine. I'm literally the gatekeeper of life-saving fluids, and all I get are complaints. It's beeping too much. It's too slow. Honey, I'm the reason you're hydrated. A little respect, please. Let's start my shift in the emergency room. Oh, the ER. It's like a non-stop action movie, but with more beeping and less dramatic music. I get slapped onto a rolling pole, and we're off to the races. 1 minute, I'm pushing saline into someone who thought wrestling a raccoon was a good idea. The next, I'm attached to a patient who's convinced the Wi-Fi password is the most critical information they need. The nurses are running around like they're on fire, yelling things like statin push, one of epi. And me, I'm just trying to keep my cool, delivering fluids at the perfect rate. It's organized chaos, and I'm the calm, rhythmic center of it all. If you see those doctors and nurses getting all the credit on TV shows, please. Who do you think is actually delivering the medicine that stabilizes the patient? Me. You're welcome. Then, just when I think I can catch a break, I get wheeled up to the ICU, the intensive care unit. The vibe here is intense, to put it mildly. It's a lot quieter, but don't let that fool you. The stakes are sky high. In the ICU, I'm not just a saline pusher anymore. I'm a high-tech cocktail mixer, juggling 3, 4, sometimes 5 different medications for one patient. Blood pressure meds, sedatives, antibiotics. It's a symphony of dribs, and I'm the conductor. Each drop is critical. It's free holiday. One wrong move, one little miscalculation, and things go south fast. The nurses here are meticulous. They stare at my screen, triple-checking my settings. They treat me with the respect I deserve, but the pressure is immense, and the beeping. If I make a peep in the ICU, everyone jumps. An occlusion, an errand line alarm. It's like a bomb threat. I'm not trying to be dramatic. 2. I'm just telling you there's air in the line. Fix it. I'm trying to save a life here, people. After the high-stakes drama of the ICU, a trip to the med-surg floor feels like a vacation. Meditor Surgical is the bread and butter of the hospital. It's where patients go to recover. The pace is slower. The patients are more chatty. And my goodness, do they complain. This thing keeps beeping. Yes, Gerald. It's beeping because your IV bag is empty. It's my way of saying, hey, I need a refill. It's not a personal attack. And the classic, can you make it go faster? No, Susan, I cannot. The doctor ordered a specific rate for a reason. I'm not a water faucet you can just crank open. I'm a precision instrument. I've had patients try to adjust my settings themselves. They poke and prod at my buttons like they trying to find a secret level in a video game. Please stop. I am literally in control of the medicine, entering your veins. Let's not experiment, shall we? Now, let's talk about the operating room. The OR is a whole different world. It's cold, it's sterile, and everyone is wearing funny hats. They usually get taped to the floor or hung up high, out of the way. It's all about efficiency here. My job is to deliver anesthesia meds, fluids, and whatever else the anesthesiologist needs to keep the patient stable while the surgeons do their thing. The music is always interesting. One day it's classic rock, the next it's 80s pop. I've heard more power ballads during a kidney transplant than I have in my entire life. The best part? The patients are asleep. No complaints, no questions. Just sweet, blissful silence. The surgeons are the rock stars. The anesthesiologists are the silent guardians. And I'm the roadie, making sure all the equipment works. It's a team effort, but let's be real. The show couldn't go on without me. Finally, we have the obstetrics ward, or as I call it, the happy chaos department. This place is an emotional roller coaster. One room is filled with the sounds of a brand new baby crying, and the room next door is filled with the sounds of a baby on its way. My main gig here, epidurals and Pitocin. I am the bringer of relief and the accelerator of labor. When a mom to be is in pain, I am her best friend. The way her face relaxes when that epidural kicks in. It's a beautiful thing. I feel like a superhero. But then comes the Pitocin to help labor along. And I go from hero to villain real fast. Turn it down. The contractions are too strong. Turn it up. Nothing is happening. I can't win. I'm just following orders, trying to help bring a new life into the world safely. It's messy, it's loud, it's emotional, but honestly, it's probably my favorite place to be. Seeing a new family begin, knowing I played a small part in that. It almost makes up for all the complaints. Almost. So, from the adrenaline of the ER to the precision of the ICU, the grumbling of med-surg, the quiet focus of the OR, and the miracle of obstetrics, I've seen it all. I've been yelled at, poked, prodded, and mostly ignored. But at the end of the day, I keep on pumping. I keep on beeping. Because that's my job. I'm the silent, tireless guardian, hanging by your bedside. So, next time you see one of my kind, maybe give a little nod of appreciation. We're working hard for you, even when all you want to do is silence our alarms. Thanks for listening to my rant. It's been therapeutic. Now, if you'll excuse me, I think I hear my alarm going off. Someone's bag is probably empty. The work never ends. Don't forget to follow for more hospital confessions. We won't believe what the bedpan has to say.